All right, so check it out. Total knee replacement, right? It's painful. It's really hard to get your range of motion back. People are struggling. They want to get off medications as quickly as possible. So we have a patient here today who is 3 weeks out from a total knee replacement. X-rays look fantastic. Can you show us near full knee extension and amazing flexion? How are you feeling?
I feel great. I only took opioids for 4 days. After that, I didn't take anything. I've been doing my exercises. I've been walking 10 minutes and built it up. And
So you're doing physical therapy?
Oh, I do physical therapy on Monday and Thursday. I do laser treatment on Tuesday and Friday.
Do you really feel like the laser therapy has been helping?
Yeah, it really loosens up the muscles in the back of my knee, and it's helped with the swelling. I love it.
So at 3 weeks, it's pretty remarkable to have really up 120 degrees range of motion.
120.
Took pain medication for 4 days only. You're walking without any assisted devices, and you're taking Tylenol or Motrin for pain at this point.
I'm not even taking anything for pain.
Amazing. Laser works for your
Laser works
post-operative
really good.
patients. Laser works really good.